Right. I think I also recollect that during my pregnancy, you had recommended few tests to be done,
Yeah.
which will help early detection of Down syndrome with a baby, if any.
Yeah.
Yeah. So, do you want to share something with
Yeah. The
viewers?
tests which the doctor advises in the antenatal care are very important.
Right.
So in the first visit, we typically advise a woman a complete blood count, a urine routine so that to rule out any infection. We see her sugars. We see her thyroid status. She should not be hypothyroid or hyperthyroid. That we come to know by the TSH levels.
Okay.
There should not be any infection like HIV, HBsAg, HCV or VDRL, that is syphilis.
Okay.
So these are the basic tests which we do.
Okay.
Nowadays, with the advance in the imaging techniques, we advise them sonography.
Right.
Early sonography, as early as 1.5 months, detects the gestational age of the baby by a crown rump length.
Okay.
And in the woman, like you said, in PCOS, the cycles are irregular. Our dating becomes difficult.
Right.
So this sonography, the first sonography, gives accurate dating. Then you mentioned about Down syndrome. Down syndrome is essentially trisomy 21.
Okay.
So there are 3 pairs of chromosome 21. Otherwise, we all have 2 pairs of all chromosomes.
Okay.
Now, these babies can be very severe Downs, or there can be a mosaicism. And some of the chromosomes are having Downs.
Okay.
There are certain tests like a dual marker test and a sonography at around 11 to 12 weeks called a genetic scan, where we see the thickness of the nape of the neck and we see whether the bridge of the nose is forming.
Okay.
There are other soft tissue markers. So this helps us to predict whether this baby is normal,
Okay.
and if it is normal, we can reassure the woman that the baby is normal. We can do a dual marker test at between 11 to 13 weeks.
Okay.
That is, there's a quadruple test at 4 months, around 16 weeks. These tests are screening tests.
Okay.
Means they will help to tell the obstetrician that this patient is a high risk of a Down's baby or a baby with a genetic abnormality. And then it is not confirmatory. So we can screen those women who may require a confirmatory test by we do something called amniocentesis. By sonography guidance, we put a needle in the abdomen under sterile aseptic precautions. We remove some fluid and we test it for the genetic makeup called karyotyping. And nowadays it is called microarray, which can give us genetic defects.
Okay.
Then also we do an anomaly scan at around 18 to 20 weeks, a cardiac 2D echo scan if required in the elderly age group or diabetic mothers around 24 weeks. A growth scan at around 30 weeks, that is 7.5 months, and a Doppler test at full term. Why all these tests are required is that we have to ensure the healthy baby. Why that Down syndrome test is very much important is suppose the baby has a genetic defect, then in our country the MTP rules are very lenient. And nowadays we can do medical terminations legally under government approval in a government approved center
Okay.
up to the gestational age of 24 weeks, that is almost 5.5 months.
Okay.
So the couple can decide whether they want to continue an abnormal baby. The sonography helps to diagnose the anatomical abnormalities, like suppose some of the babies are having half skull, sometimes they have a defect in the spinal cord, sometimes there is the whole stomach is outside. So these defects can occur.
Okay.
We normally suggest in our pregnancy counseling that we have folic acid supplements which will prevent these defects.
Right.
But if they are there, the woman does not have to live with it throughout the pregnancy and afterwards after delivery.
Sure.
So that option of termination is there. That is why these tests are important.